Right. So thank you. So for part two, NEET MDS discussion. So we're just going to discuss the general surgery first, right? So students, I need your attention. Yes. So let's go for the first question. The NEET this question. Right. So this question is like this. Okay. So all these questions actually I'm going to upload in the Instagram, and if you go to my NEET MDS Insta page, then I'll be uploading all the questions. Okay, you can download it directly from there. Okay, so till now I uploaded 5 subjects. Probably within a 2 or 3 days, I will be uploading maximum subjects in the Insta. So if you want, you can download all the subject-wise question and answers. Right. So come back to this question. So this question is about the patient is having some tumor. Okay. And so which of the following tests we can do for this particular patient, okay, or the particular lesion? Right. So this is actually a case of hemangioma. The case of the hemangioma. So it is a, usually hemangioma is a purple tongue lesion. So this is actually not given in the exam. This is given for your reference. Okay. Usually hemangioma is a purple color lesion. Okay. If it is a hemangioma, which of the following is used? Okay, right. So coming to this electromyography, so we have something called as EMG, EMG, ECG, EEG. EMG is for the muscle activity. ECG is for the cardiac activity. EEG for the brain activity. Okay. Yes. So this is also one of the very important question in your physiology. What are the waves which are seen in the EEG, electroencephalogram? This I am telling for your INSET exam preparation or for your 2027 preparation. So electroencephalogram, which is actually have this mnemonic called back dance. Back dance. Beta wave, alpha wave, theta wave, delta wave. Beta, alpha, theta, delta wave, which is seen in the electroencephalogram. Okay, and so this is for muscle activity. I cannot use it for the hemangioma, right? I'm just eliminating this. Fiber optic trans elimination I cannot use. Okay, for this hemangioma. Diascopy, yes. So the answer is diascopy. Okay, but suppose if it doesn't know, there's a very completely new question. If we take for the last 10-15 years also, you won't get a single question from the diascopy. Okay, but suppose if I doesn't know diascopy, still I can able to answer by eliminating the other option. Okay, so I know that the skimmer test. Skimmer test is for the Jordan syndrome. Skimmer test is for the Jordan syndrome, which is used to check about the lacrimal gland function. Yes, this is also MCQ. Skimmer test is for lacrimal gland or salivary gland. It is for the lacrimal gland function. What is the one option I doesn't know? Okay, because I eliminated all the other options. For probably I can go for diascopy. Still, if it doesn't know, I can able to answer by eliminating. If we have a skill of elimination. Yes. So that is why telling this, please. Okay, if you are a student preparing for 2027, attend the multiple test mock test. Okay, so train your brain accordingly for the elimination skill and other type of skill for appear the test. Okay, right. So coming to the second question, students. Okay. So this question says about just a minute. Okay, there is a swelling in the posterior aspect of the limb. Okay, so there is an image. But the image I'm not able to give it this because when I searching this Google, I'm not able to get the exact image for this picture, for this question. On examination, the swelling was firm, mobile, and horizontal. Exactly where it is actually in the leg, backside of the leg, in the calf. Okay, basically that there is a picture which was given like that. Okay, so the key point for this is the key point, student. It is mobile in horizontal plane, but not vertical. That is the key point. Okay. Like just imagine there is a rope. Okay. There is a rope. Okay. This rope has some tie. Okay. Some tie in the rope. Okay. So this tie, okay, you can able to move the tie, okay, by this direction, right and left. Okay. But you cannot move this in here, this direction. Okay, vertical direction. Okay, exactly like this. Vertical direction, it does not move. Okay, because this tie, okay, obviously you can able to imagination, right? The tie, suppose if you just make it a rope and make a tie, and you can make the okay tie right to left, but you cannot make the tie up and down, right? So this is the feature of what type of tumor? This is the feature of is the feature of the nerve shaped tumor. If you go to the Google and if you can check about nerve shaped tumor, probably you can get an image, okay, images like it looks like a small swelling along the nerve, okay, along the nerve. So this is the feature of the nerve shaped tumor. It is not a hemangioma, lipoma. Lipoma, obviously, okay, and by seeing this itself, we can able to say there is a lipoma. And one important sign which is seen in the lipoma is slip sign. Slip side. Okay, this word actually mentioned definitely if the tumor is lipoma. Okay, since the word is not there, I can eliminate lipoma. It is not a hemangioma also, but a hemangioma also I can able to see by the lesion itself. Okay, so the one key point for this is not horizontal plane, but so not vertical, but horizontal is called nerve shaped tumor. Students, clear is okay. Suppose if we have some doubt, means just put it in the chat box. At the end of the general social discussion, I'll get back to you and clear all the doubts. Right. So coming to the question number 3. Okay, the patient actually fall from the height. BP is 78 by 55. Actually, that means less. BP is decreased. Okay, and pulse also less. Usually, pulse will be 72. BP is less. Pulse is less with warm extremities and no sensation in the lower limb. What type of shock this is? Okay, student, very, very good question. There is a no sensation means nerve is affected. No sensation means nerve is affected. But which nerve? Okay, which nerve? Okay, probably if you see the option, one of this which is related to the nerve. So first option, it is a neurogenic shock. Right. That one key point, they use this one key point, you can directly go to the neurogenic shock. But you have to go in depth. Okay. How to understand the concept little more depth. So what is neurogenic shock? What is happening in the neurogenic shock? In a neurogenic shock, sympathetic system, neurogenic shock, sympathetic nervous system is actually fall down, which is coming down in a neurogenic shock. Students, what is sympathetic system will do usually? Sympathetic system which increases the heart rate. Sympathetic system which increases the heart rate, increase the blood pressure. Okay, there is a function of the sympathetic system. Because sympathetic system is not working, obviously blood pressure is decreased. Since heart rate is decreased, pulse rate also decreased. So this is the one key point I can directly answer that is a neurogenic shock. Right? Nowhere mentioned the patient had a, even though the patient actually fall from the height, nowhere mentioned that they had a fluid loss. Okay, since there is a no word actually telling about the fluid loss, I can easily eliminate the hypovolemic shock. Students clear? Yes. Shall I move on to the next question? Yes, this is also a very good question. A new question actually. A patient presented with the lymphedema. Okay, the clinical test is shown in the image again. So the image is nothing but actually somebody is okay pinching the skin and elevating the skin. Okay, and so inability to lift the skin on pinching. Very actual question. So the image is something like this. Okay, just pinching the skin and elevating the skin. Okay, so if they not elevating the skin, the inability to lift the skin on pinching. What is this sign is called as? This sign is called as stemmer sign. This sign is called as stemmer sign. Why? What it is? Stemmer sign means what? Okay, for you and me, okay, if you just able to, okay, if you able to hold the skin, yes, you can able to hold. Okay, so, but for a patient who has a lymphedema, okay, the skin will go for fibrosis. The skin will go for fibrosis, meaning what? Nothing but thickening. Fibrosis will thickening. So skin will go for thickening. But so if it is a thickening, then you're not able to pinch the skin. Okay. So that is called as stemmer sign. If you're not able to do this, this is called stemmer sign. If a lymphedema patient are positive to stemmer cell or negative to stemmer cell. This is a positive to the stemmer cell. Okay, lymphedema patient has a positive to stemmer cell. You know what is called lymphedema? Can you give one example for lymphedema? One example for lymphedema. Filariasis. Filariasis is one example for the lymphedema. Yes. Right, students clear? And okay, so we have something called as multiple sign. Where is the multiple sign saying? Multiple sign saying cholecystitis. Multiple sign is saying cholecystitis. Okay. Students, any more doubt? Okay. So if you have any doubt, please post in the chat box. Okay, at the end of the session, I will be answering all your clearance. Okay, the students. Okay. Father Gills. Father Gills is about rectus sheath hematoma. It is not related to dentistry, but just look. Okay, rectus sheath hematoma. Good question. Rectus sheath hematoma is called as the Father Gills site. Okay, and what about Turner site? Turner site is saying pancreatitis. Okay. Turner sign saying pancreatitis. So this is actually important. Okay, very long back they asked me this question. Murphy sign. Murphy sign is polycystic, seeing polycystitis. Students clear? Yes, sir. Shall I move on to the next question? Question number 5. Yes, this is actually a very good question. The image is attached to here. Yes, a nice question. Okay, what are the key points? Yes, I'm telling this. The diabetes related question definitely there will be in your NEET exam. Any NEET exam if you take last 4 years, definitely minimum one diabetes based question. Okay, but this year almost 4 to 5 diabetes based question. Uncontrolled diabetes brought to the emergency department. The clinical presentation is shown in the image. It gives the history of the insect bite a few days ago. What should be the management? Okay. So this is the question actually. What is this picture actually? If you see the picture and able to identify, then you can be able to answer for this question actually. So this picture is telling about gangrene. This picture is telling about the gas can, which is telling about okay. What is gas gangrene otherwise called as? Gas gangrene otherwise called as clostridial myonecrosis. What is this called as? Clostridial myonecrosis, right? So usually students, but very important, if there is a gangrene is, which is called necrosis with the putrefaction is called as the gangrene. In case of a gangrene, we give only antibiotics, it doesn't work. Why it doesn't work? Hyperbaric oxygen doesn't work. Why? Because there is a reason. The reason is, okay, there is a necrosed area. For an antibiotic to reach to work in a particular area, okay, if it has only blood supply, it reaches that area. If there is no blood supply, how the antibiotics reach? Okay, so necrosed area doesn't have blood supply, antibiotic doesn't reach. So antibiotic is not much effective in gas gangrene or necrosed area. Okay, so say even IV fluids and analgesics also destined to go there. But what you have to do, you have to go for the fasciotomy and the surgical debridement. What is called surgical debridement? Okay, just clean all those areas. All the necrosed areas you have to clean. Okay, so fasciotomy is just to remove the facial plate. Okay, remove it and followed by you can give antibiotic, then it works. Just antibiotic doesn't work. Just an IV fluid doesn't work because it doesn't have blood supply. Okay, that is the reason. So you have to go for C. Students clear is so shall I move on to the next question, students? Question number 6. Yeah, this is actually is one more question. Okay. So students give some time. Should I just added the pictures better? The pictures are missing. So just give me 2 minutes. Time. Give me 2 minutes time. Yeah, one more question. Is students, you can able to see the picture, right? Yes, yes. Thank you. Right. So the question is about patient has swelling the neck for since last 10 months. Okay, so is noticing palpitation in weight loss recently. The swelling moves with the degradation. What is the diagnosis? Whenever you see the keyword like swelling moves with the degradation, there's a one key point for thyroid related illness. Thyroid related illness. But unfortunately, all the four options here are thyroid related. Okay. We have other option actually you can easily answer for this question. But our unfortunate, right? But still you can able to answer. Okay. So you can see there is some nodules are presented. Okay, nodules are present. If I can say I can eliminate this. Okay, I can go for multinodular goiter, simple multinodular goiter or toxic multinodular goiter. Okay, right. What answer I can go for? I can go for toxic multinodular goiter. Why I can go for toxic multinodular goiter? Because the patient is having symptoms. Yes, he is noting the palpitation and weight loss. Palpitation and weight loss usually seen with the hyperthyroidism students. Palpitation and weight loss is seen with the hyperthyroidism. Obviously, if there is a more thyroid hormone, BMR is more. Basal metabolic rate is more. If there is a metabolism is faster, usually the patient will go for weight loss. Whenever the patient is going for hyperthyroidism, it is called toxic. Okay, so answer is what? Toxic multinodular goiter. Yes. So coming to the next question, students. Almost the same type of question. Anorexia, palpitation. Okay, yes. Increase, that means what? High thyroid hormone is more. Increase in blood pressure, heart rate. Okay, so everything is related to thyroid hormone. Okay, the swelling is next. The swelling on the neck is same. Lymph nodes are palpable. It moves with debilitation again. That's a very common keyword because everything is thyroid related. So what is the key point which differentiating factor from other options? So the answer is papillary carcinoma of the thyroid. Yes. Why there is a why I am going for papillary carcinoma of thyroid students? Anyone? Yes. It's a very good sham, very good, excellent, excellent, awesome, awesome. Usually, this papillary carcinoma of the thyroid is spread to the lymph nodes. Very important. Okay, what is the one key point? Is very important here means this is the key point. Lymph nodes are palpable. Okay, so I can go further. So that is the key point which I am telling for papillary carcinoma of the thyroid. What about follicular? How the follicular carcinoma spread? Come on, anyone? How the follicular carcinoma spread? Follicular carcinoma spread by, okay, yes, come on. Blood. Follicular carcinoma spread by blood. Hematogenes. Okay, so since lymph node is given, I go for the papillary carcinoma, right? So again, it is a very good question. Very good question. So the question is about the patient went for some surgery, hernia surgery. There was no break in the procedure during the surgery. And the post-operative period was uneventful. Uneventful means good, no problem. That is called as uneventful. Usually, we write it as in a case sheet for after doing the extraction, uneventful extraction, right? Uneventful is no problem. The doctor wants to classify the wound for decisioning, prescribing antibiotic therapy. What is the type of wound actually? Very good question. So recently, um, 1 month before, my father had actually hernia surgery. Okay, after the surgery was happened for 45 minutes, 45 minutes to 1 hour actually. After the surgery is completed, actually he shifted to a room. Okay, and they prescribed some drugs, actual painkiller, antibiotics, all those things. Okay. So when I'm saying the antibiotics, only there are two antibiotics, just two. Okay, like so he shifted almost. 2 o'clock. 2 o'clock afternoon. Surgery was happened in the morning. 2 o'clock, actually, after the anesthetic effect, he just shifted. So after 2 o'clock, there was one antibiotic, and night, okay, during after the meals, one antibiotic they prescribed. So there's so much curiosity. I asked the doctor, so given only two antibiotics, is there anything you missed? Shala, okay. So the doctor, because even for extraction, we give antibiotic for 3 days. Right, 3 days, three times. Okay, but with so much curiosity, I asked the doctor. Actually, the doctor told, so the surgery which was done in the entire sterile pain, Shala, we are so cautious that we are doing this procedure. Actually, we should not give any antibiotics, but since we are living in India, we just given only these two antibiotics. So what the doctor told me. Okay. So when I see this question, I just had the same thinking. Actually, this the question is about okay hernia surgery, and there was no break in the procedure. Okay, it was completely sterile, okay, and the post-operative period was uneventful. So what is this type of wound is called as? This type of wound is called as what? Because it is running a completely sterile field, it is called as the clean. Here, I cannot say clean contaminated or dirty contaminated, right? So, easy question, logical question, actually. This type of question you cannot search in books, actually. Using the logical thinking, you should be able to answer. Among the 240 questions, students, remember this point I am telling over by 2027 exam. You cannot expect all the 240 questions in your book or you may come across with your notes, video, anything. Okay. So 30 to 40 questions, 30 to 40 questions, you can use it your logical and you should be able to answer. Okay, so the know questions are at least minimum 30 questions will be there using your logical and answer. Okay. Right. So this is actually a evergreen topic. Evergreen topic. In the last 4 years, at least minimum three times this question was repeated. It- what type of hemorrhage occurs after 24 hours of surgery? And it is usually caused by infection. It is a key point, right? So, if the hemorrhage has happened at the time of the surgery, it is called primary hemorrhage. Suppose if it is happened within few hours, okay, because of the increased pressure, so there is a sutures will be like okay, so ligated suture will slip off. So the hematoma is happened or hemorrhage is happened because of this, then it is called as reactionary hemorrhage. Okay, so secondary hemorrhage, it usually caused by the infection. So this is key point. Caused by the infection after 24 hours. So answer is the secondary hemorrhage. Students clear is this is actually everything topic asked many times. Okay. So this is actually one more good question. The patient has a KDC, okay, and there is an abscess along with the palpable, tender, mobile lymph nodes. Lymph nodes are palpable. After management and administration of antibiotics, the lymph nodes are shuttled down normally. What would have been the cause? Okay, yes. So nowhere they mentioned something related to the tuberculosis. Okay. So I can easily eliminate this tubercular lymphadenopathy. Easily eliminate. This is again one of the eliminating type of question. Malignancy, nowhere it is given. Nowhere it is given as a malignancy picture. Okay, weight loss or any picture, they're not given. Anything related to okay, metastasis is not given. There is something related changes into the enlargement of the lymph node. Lymphoma, again, a type of a malignancy. Okay, and this eliminating. Hodgkin's lymphoma, non-Hodgkin's lymphoma, there is no something related to the malignancy. Now, what is the one option which is present here after elimination? The one option, reactive lymphadenitis. Okay, the lymph nodes are react to the infection. So that is called reactive lymphadenitis. Yes, sir, students. So coming to the next one. So a patient got a fracture of the long bone. Okay, probably we can take it as the femur. According to the Footbus and metabolic response to trauma, which are the following is the characteristic of the EF phase immediately after the injury. So what is called as EF phase? It is a very logical question. Okay, usually what will happen after trauma, the patient okay, patient will be in a injured state, actually, our body will do some compensatory mechanism. Okay, what is the compensatory mechanism our body will do after a injury? It decrease the metabolism. Okay, so if the metabolism is happened, what will happen? We lost the energy, right? So it decrease the metabolism, okay, and decrease the oxygen consumption, everything. Okay, obviously, this is the answer. Reduced metabolic rate with the decreased oxygen consumption. Okay, we can relate this and this. Usually, for a metabolism, you need more oxygen. You need more oxygen for the metabolism. PMR. For a PMR, you need more oxygen. If you have a decreased oxygen consumption, metabolism will be decreased. Yes. So this is the answer. So this is exactly opposite hypermetabolic state. Usually after a severe injury, okay, the body's metabolism will come down. Okay. So this is also not related to this. So we can again go for the four option. Fourth option. Yeah, this is again a good question. Okay. What is the diagnosis of the condition shown in the image? Okay. So what is the structure? This is nothing but lingual thyroid. Lingual thyroid. So usually thyroid which develops from the posterior part of the tongue, we have an extension comes down to the neck, and it produces two lobes connected by the isthmus. Okay, so this area, the posterior part of the tongue, glossus. This is thyroid. So this is called as thyroglossal duct. Thyroglossal duct. This thyroglossal duct usually disappear after the formation of the thyroid gland. It is disappear. But there are some patients it will be persist and it will go for thyroglossal cyst, thyroglossal fistula. And sometimes what will happen? This thyroid gland, which is formed here in the posterior surface of the tongue, does not comes down. Does not comes down. If it does not come down, it will stay there itself. Okay, so this is called lingual thyroid. I'll show you the picture. Is students clear? You see again, this is one more image-based question. Is I'm not able to get the exact picture what is given in the exam. I'm just searching some picture related to this. Okay, close to the exam asked. Okay, I'm just able to get this picture almost. Okay, not exactly. Okay, so and one more thing is most of the image-based question which is asked in the 2026 actually image is not needed. Just to consume your time and to make you panic, they added image. Most of the question actually are the theory itself enough. You need not to see the picture itself. Okay, so yes, just see this. So there is a lesion near to the ear showing a nodular growth. Histopathology will say well-defined encapsulated nodular lesion composed of baseloid cells. What is the diagnosis and appropriate management? Here. So this is actually happened in the middle third of the face. Okay, usually what is common in middle third of the face? Basal cell carcinoma. Most common site of the basal cell carcinoma is the middle third of the face. Right. So up I can eliminate this one. Okay, there is a no term called as basal cell amyloblastoma. Okay. So I can easily eliminate this. So what is the remaining option? Basal cell carcinoma with the excision and neck dissection. This is just an excision. So which will be the option? Remember, students, the only carcinoma does not metastasis is basal cell carcinoma. That is actually a very good picture of basal cell carcinoma. Okay, so that is why basal cell carcinoma is usually called as benign carcinoma. Basal cell carcinoma is called as benign carcinoma because it does not metastasis. Suppose if God comes, okay, and I'm telling you that so according to the Vidi, so I have to give some cancer to you, okay, but I will give one option, okay, so you itself actually decide what type of cancer you want, okay. About what cancer you can ask to the God, so God will give me basal cell carcinoma, okay. So because it is a cancer, that it is a good cancer because it does not metastasize that much easily. Okay, which option I can go for? This or this? Because neck dissection is not needed because it does not metastasis. So simply I can go for basal cell carcinoma with excision. Okay, so second option. right? So coming to this is also something related to this. This there is a slow growing, that is basal cell carcinoma, again a slow growing. Okay, and this is actually a rodent also. Again, it is a more common. The picture is shown in the middle third of the face. Okay, so I can go for this basal cell carcinoma. Students, I just wanted to convey one important point here. Okay, suppose if you have two questions related to the basal cell carcinoma, right? This is one basal cell carcinoma, this is one basal cell carcinoma. Usually, this type of repetition will be very common. The topic repetition is very common in NEET exam. Okay, suppose even if you doesn't know the answer for this question, okay, you can take a risk and go for basal cell carcinoma because okay, at least in a topic, probably you will be asking two questions. If the topic is repeating, they will be asking two different questions. Actually, okay. So that is one natural example. One point keep in mind. Suppose if you're not able to identify that, you can take a risk and go for same type of topics they ask in your exam. Right? So we completed general surgery. Students, any doubt in the general surgery question? Shall I move on to the next part, general pathology? If you have any question in general surgery, you can ask me. Okay, I'm just clarifying your doubts. Okay, Yamini, thank you. Okay, all right. So shall I move on to the next part, students? Thank you. I pick right, very good. See you, Ashwini. Thank you. So let's move on to the general pathology. This general pathology. So yes, let's see this question. Yes, it is a little bit difficult question only actually. Most of the students are actually not attended this question. Yes, we'll try. Correct. In patients present with the recurrent episodes of the infections affecting both the respiratory and oral sites, laboratory evaluation suggests there is an enzyme deficiency called ADA. What is ADA? Is adenosine deaminase deficiency, which leading to the impaired immune function, which are the following cells is primarily the question, right? So, students, okay, let's go for this question. I can easily eliminate eosinophils, okay, because it does not have a good immune property when compared to the other things, right? So, what is the function of the AD? What is the function of the AD? AD is present in the nucleus. AD is present in the nucleus. Adenosine deaminase enzyme, which is especially helps for the breakdown of toxic product in the nucleus. Breakdown of the toxic product which is accumulated in the nucleus, especially which is T lymphocytes. Especially T lymphocytes. This is present action. Suppose if the enzyme is not present, what will happen? Toxic product is not metabolized. The toxic product is not breakdown. So the accumulation of the toxic product, which itself kills the T lymphocyte. Students, I repeat one more time. Okay, just I'm taking a T lymphocyte. There is an enzyme which is present called ADA. What is the function of the ADA? It actually helps for the breaking the toxic product. But here they say the enzyme is defective. The enzyme is defective, toxic product does not break down. That accumulated toxic product which kills the T lymphocyte. T lymphocyte doesn't work. Okay, so that is why I'm going for the answer T lymphocyte for this particular question. There's a one question which was asked previously. Okay, neutropenics for the patient who has a neutropenia. Recently, they asked me this question in your NEET exam. 3 years before. What is the drug of choice for neutropenia? That is the question. Anyone? Anyone? What is the drug of choice for the neutropenia? Okay, anyone who attended going to write 2027 paper? Filgrastim, very good. Yamini good. Filgrastim is. And what is the B lymphocyte produce? B lymphocyte produces what? B lymphocyte is produces. B lymphocytes are otherwise called as what? B lymphocytes are otherwise called as plasma cells. B lymphocytes are otherwise called as plasma cells. What is a very important characteristic feature of the plasma cells? Plasma cells have nucleus, which is called eccentric nucleus. Eccentric. What is called eccentric? Away from the center is called as eccentric. Eccentric. So that is why the tumor of the B lymphocyte, you will have some appearance called as, what is the tumor of the plasma cells? The tumor of the plasma cells are called as multiple myeloma. Okay. If someone asks you, what is the appearance which you see in the multiple myeloma, what will be your answer? The answer is cartwheel appearance. Cartwheel appearance. Cartwheel appearance is produced because of the eccentric nucleus. Students clear eccentric. So these are some of the extra points which you should know. Eosinophils usually increase in allergic reaction. That is why I eliminated this option. Eosinophil increased in allergic reaction. Right. So come back to this question. This is again a very good question. Okay, so recently we actually started with the general pathology. Okay, this is your turn. You are going to be answer students for 2027 batch students. You are going to be answer. I'm just waiting for your answer. Okay. So what is the key point? Liver biopsy shows accumulation of the fat droplets. This is the question. What is the stain which is used for the fat droplets? Whoever attended my first part, you should say. Shyam, very good, excellent, excellent, excellent. Kanishka, okay, this question I'm just taken before the exam. Okay, general pathology, first part I'm just taken it before the exam. Okay, if you attended my class, you can able to answer this question because this will be completed. General pathology, this part I completed. Obviously, what? Oil red wool is Subiksha, very good. Sudan Black and oil red wool is for the fat droplets. Congo red is for what? Congo red is for amyloidosis. Okay. PAS. Periodic acid skip. Periodic acid skip is for the fungal cell wall. Okay. Prussian blue is for the iron. Iron, right? So, yes, you have to answer right. Okay. So this next question. This is actually we can able to answer. Okay, by having your knowledge in second year. Yes, the 7-year-old boy experience uncontrolled bleeding. Okay, this is a key point. Okay, but what is I can expect? Okay, uncontrolled bleeding means I can expect the patient may have some blood disorder. What blood disorder I can expect is, since they are talking about the genetic disorders, type of the inheritance. Type of the inheritance I am talking autosomal dominant, autosomal recessive. Okay, I can expect the patient may have hemophilia. So this Sunday for 2027 batch, I'm going to take this part only. Genetics I'm going to take super class. The class will be, you can enjoy like anything. Okay, so there are a lot of points which you are going to study in the genetics this Sunday. It's already okay. So this is the hemophilia. One of this maternal uncle also has the same problem. The childhood. What is the type of thinking? They're talking about only the males, not related to mother or auntie, something. Okay, this is related to only the males are affected. Okay, boy, uncle, males. Since it is getting about only the males, what type of inheritance is this? It is a X-linked recessive. Usually, X-linked recessive, females doesn't affected. If females may act as a carrier, they won't affected any X-linked recessive disorder. One very important take home message, right? Okay, so what about mitochondrial inheritance? Mitochondrial inheritance, otherwise called as maternal inheritance. Mitochondrial inheritance, otherwise called as maternal. What is the calling of maternal? Maternal is mother. The mother is transmitting the disease to all the daughters. Mother is transmitting the disease to all the all the next generation. All the next generation people, whoever, whether it is boy or girl, whoever is affected by the mother. Okay, suppose mother has 4 children. If all the 4 children got affected, it is a type of maternal inheritance or mitochondrial inheritance. So this Sunday we will go in depth actually. Probably I will go genetics itself. I will be taking almost 1.5 hours to 2 hours class. So after that, you get so much confident in genetics. Any type of question you can able to answer. Yes. So this question actually, students, a very very simple, easy question. Okay. So it's delayed healing. This is one important point. Delayed healing. Okay. And petechia is the second key point. Poor wound healing again. Okay. So among the four, which is related to the delayed wound healing. So easy, so easy. Using your previous knowledge itself, we will be able to answer. Obviously, she was good, permits the sham good. Delayed wound healing, which is seen with the scurvy. Okay, because scurvy is what? Scurvy is nothing but vitamin C deficiency. Vitamin C is needed for what? Vitamin C is needed for the collagen synthesis. Obviously, there is no collagen synthesis is there. Wound healing will be delayed. So straightforward question actually. Is which organ in the body does not have collagen? This is actually discussed in the first part of the class. Brain. Sri Varshini, good. Shamika, very good. Sasima, good. Brain does not have the collagen. Yes. This is again one more question, students. Very good question. Very good question. A lot of question in the last 5 years related to this type of question. Very, very, very important. Must to know topic. The patient has a gastrointestinal infection. Was on a prolonged broad spectrum antibiotics. Super key point. This is prolonged broad spectrum. Okay, they give it the name itself actually. Clindamycin antibiotic therapy. Now presented with the diarrhea. What is the most likely diagnosis? Very, very, very important question. Okay, must know topic. 100. Okay. So without knowing this concept, we should not go your NEET 2027. Correct. If the patient is taking the broad spectrum antibiotic like clindamycin, the patient will be affected by pseudomembranous enterocolitis. Patient is class what? Pseudomembranous enterocolitis. What is the meaning of pseudomembranous enterocolitis? Okay, that means what? An antibiotic which keeps the bad organism, even the good organism also. Okay. So since the good organism also kill the action of it causes a membrane. It is called as pseudomembranous enterocolitis. If there is a formation of the pseudomembranous enterocolitis, the patient will affected with diarrhea. Because since no absorption takes place, there is not as diarrhea may happen. Which organism causes this pseudomembranous enterocolitis? Which organism? Clostridium difficile, which causes this pseudomembranous enterocolitis. The most common antibiotic which causes this pseudomembranous enterocolitis is clindamycin. Next question. Most common antibiotic which causes the pseudomembranous enterocolitis is clindamycin. What is the drug of choice for pseudomembranous enterocolitis? What is the drug of choice? What is the drug of choice? Metronidazole and vancomycin. Metronidazole and vancomycin are the drug of choice for the pseudomembranous enterocolitis. Students, you got it? Yes, sir. Only stay or good. Thank you. Yes. So next question. The patient will have microcytic hypochromic anemia. Okay. Key point. One key point. Increase the reticulocyte count. Peripheral shows the excessive evidence of hemolysis. Very, very important point in this question. Which are the following is the most likely diagnosis? Shreya, wait, Shreya. Yes. Actually, many of the students which made this mistake, when they see about microcytic hypochromic anemia, immediately they went for iron deficiency anemia, like how Shreya Krishnan did now. Okay. But this is not iron deficiency anemia, it is a track question to differentiate the normal student, average students from student who preferred it. And they have, okay, right. So let's go for one more key point which is writing here, which is called as the hemolysis. Okay, right. So hemolysis happened where? Hemolysis happened when the patient has this G6PD deficiency. G6PD deficiency. Why? Because G6PD, that is glucose 6-phosphate dehydrogenase. Okay, what is the function of this G6PD? It's actually present inside the RBC. Present inside the RBC, prevent the oxidation of the RBC. Prevent the oxidation of the RBC. Okay, in case if there is a deficiency of the G6PD, okay, the RBC will go for oxidation. Oxidation means breakdown. Okay, that leads to what type of anemia? RBC is breaking. So what type of anemia it is? It is actually the patient may go for like hemolytic anemia, hemolysis. Okay, so that is why the hemolysis is given. I can go for the G6PD deficiency. Students clear is able to understood, right? Yes, but iron deficiency anemia, like hemolysis is not safe. Okay. So I probably when you go for general pathology next specific classes, you can able to understand this type of concepts. Okay. Yes, sir. Any doubt in this? Okay, and G6PD, the breakdown RBC which all produces some inclusion bodies. That is also asked recently one of the NEET exam. What is this inclusion bodies are called? These inclusion bodies are called as Tails bodies. Tails bodies. Tails bodies are seen hemolytic anemia. Students clear? Yeah. I can eliminate megaloblastic anemia, aplastic anemia because all this we cannot say the hemolysis. The one key point which determines the answer, okay, is hemolysis for this particular question. Okay. Yes. So these are these 6 questions which are asked in your general pathology students. Any doubt from the general pathology? Shall I move on to the next step? Okay, general medicine we completed actually the last class. Go to the next section. So go for the next subject, microbiology. Okay. Shreya, thank you. Yes, this is the first question. Okay. So there is a village who works with an animal rights, present with their painless black structure on the forearm associated with some edema. What is the most likely causative organism? Good question, actually. Yes. So which organism causes this? What is the one key point which determines the answer? Actually, it works with the animal. Okay, so among the four, which is spread through animal, just usually we call it as zoonotic disease. This is spread from animal to human, which is called as the zoonotic. Okay. So which is the zoonotic disease? Among the four organisms, anthrax. Anthrax is the zoonotic. You will be studying this in microbiology. Don't worry. Okay. Everything I will be teaching in forward 2027. Don't worry. This is zoonotic disease. This bacillus anthrax has three types. Okay. One type which is called as cutaneous anthrax. The second type is called pulmonary anthrax. Gastrointestinal anthrax. There are three types of anthrax. This is actually, since it is related to the skin, it is called as cutaneous anthrax. Something to put it. Cutaneous anthrax, otherwise called as what? Usually, this anthrax is more common in the people who carry the luggages in the bare body. Okay, with behavior. Okay, so that is called portus. You know, called portus in the railway station. So that is why this cutaneous anthrax is more otherwise called as hide portus disease. This is otherwise called as portus disease. Cutaneous anthrax. What about pulmonary anthrax? Pulmonary anthrax are the people who are working in a wool factory. Wool factory actually who inhale the anthrax, go and affect the lungs. So this is called as pulmonary anthrax. Pulmonary anthrax otherwise called as wool sorter disease. Pulmonary anthrax otherwise called as wool sorter disease. Yes, so gastrointestinal anthrax. The people who are consuming a food The food means what? The animal. Okay. The animal, who consuming the animal, okay, without a proper cooking. Okay, and if the animal is already infected with anthrax, maybe it will go affect with the GAT, which is called as the gastrointestinal anthrax, which has a very good mortality than compared to the other food. Okay. So mean what? More risky. Gastrointestinal anthrax has some more mortality. Right. Coming back to this question. And student, this is actually a very, very important organism. The examiners loves to ask this question, Pseudomonas aeruginosa. Even this year, there is a question came from the Pseudomonas. Every year, at least one question you can expect from Pseudomonas. Okay. Pseudomonas is a very, very important organism in many ways. Okay, usually when you see the advertisement for Dettol or Lysol, usually they put it as 99.9 percentage. Where is 0.1? Who is the 0.1? Who is the culprit at 0.1? The 0.1 culprit is Pseudomonas. Pseudomonas does not killed by the Dettol. Okay, okay. Meanwhile, the Pseudomonas actually grow well in Dettol. So that is why the selective medium for the Pseudomonas is cetrimide agar. Cetrimide is an antiseptic. Okay, so what is the culture medium for the Pseudomonas? The culture medium for the Pseudomonas is cetrimide agar. Yes, sir. And Pseudomonas usually produces pus in a different color, blue color, red color, green color. Okay, like this, it produces different pus. If it produces a blue color pus, it is called as phyocyanine. If it produces a red color pus, it is called a pyorubin. If it produces a green color pus, it is called as uracil. A different pus. Okay, by seeing the pus itself, you can come to an idea the patient got a pseudomonas infection. Almost I'm talking about 35 years back, he doesn't have a good antibiotic for the pseudomonas. At that time, if the doctor sees some pseudomonas infection, the doctor calls the relative and tell him that saving this patient is impossible. So don't waste the money. You can bring the patient to the home so we can't. So, but after that, we have very, very good antibiotic for pseudomonas for recent days. Right, next one is a very, very easy question. I cannot say easy question. To whoever studied this particular point, they can be able to answer this. This is the key point actually, the intracellular mastigode. Okay, that is the key point. Intracellular mastigode, otherwise called as LD bodies. It is called as what? Mastigode, otherwise called as LD bodies. What is LD bodies? Leishmania donovoni bodies. The name itself says the Leishmania donovoni bodies. So the answer is so easy for me. Leishmania, Kala azar. Kala azar, otherwise called as visceral leishmania. Kala azar, otherwise called as visceral leishmania. Okay. Can anyone tell me what is the drug of choice for Kala azar? Any students who is preparing for 2027? Okay, can you tell me what is the drug of choice for leishmania? What is the drug of choice for Kala azar? Yes. Come on, yes. Anyone? 2026 students. Yes, sir. Very good. Sodium, sodium skibogluconate. Sodium skibogluconate. No. I put this in notes. It is not a fungus. The sodium skibogluconate is the drug of choice for Kala-azar. Kala-azar is nothing but what? Visceral leishmania. You can see the leishmania, don't know what about this. It's called abestigode within the macrophage. It is present within the macrophage. Right? So shall I move on to the next sequence? Patient with fatigue, generalized weakness, occasionally tingling sensation. Okay, now got damage. Now is gotten damage. So what type of anemia? Okay, okay. Microcytic hypochromic anemia. This is actually one key point. Microcytic hypochromic anemia. So obviously, what is the access to it? Yes, sir. Obviously, iron deficiency anemia. Okay, among this four. Okay. Highly sensitive. Microsensitive hypochromic. Yes. So next question. This question is so good. We're talking about crescent shape. What is called crescent? It's called crescent. Glossitis peripheral blood shows red blood cells. What is the most likely diagnosis? Crescent cells are seen. Sickle cell anemia. Look, look like sickle. So it's called sickle cell anemia. What is the problem with the sickle cell anemia? Anyone? What is the problem with the sickle cell anemia? Usually, when you take an RBC or hemoglobin, okay, you have how many chains? Means you have four chains. Adult has four chains. Two alpha chain, two beta chain. Okay, two alpha and two beta chain. Very good, Shyam. Very good. Okay, beta chain. Okay, which is okay. You have many amino acids. Okay, sixth amino acid. Okay, you have many amino acids. First, second, third, fourth, fifth, or many amino acids. Almost 141 amino acids are present in the beta chain. Okay. Sixth position, there is an amino acid which is present. What is that amino acid, students? What is the amino acid which is called as glutamine? Glutamine is usually present for us, but it was replaced by valine. It was replaced by valine. Glutamine is replaced by valine. When the glutamine is replaced by valine, the patient will get normal or biconcave shape RBC became sickle shape. Why it has happened? It has happened because of some mutation. What is the mutation which has happened here? It is called as point mutation. All these are NC. What is the type of mutation? Point mutation. What is the problem here? Beta chain, sixth position, there is an amino acid called glutamine. Sorry, sir. Okay. Student, am I audible now? Yes, sir. Am I audible? Yes, thank you. Sumita, thank you. Soundarya. Here. So, flea bitten appearance seen in the malignant hypertension. What is the meaning of malignant hypertension? Whenever you see the terminology called as malignant, that means severe. That is the meaning of malignant. So, very increased blood pressure, which is called as the malignant hypertension, the patient will get a flea bitten appearance. So, on histopathological examination, we show the patient will get what type of appearance? Onion skin appearance. Histopathology findings of the malignant hypertension is onion skin appearance. Okay, right. So, and yeah, onion skin appearance also seen in where there are so many conditions. One which is called Ewing sarcoma. Ewing sarcoma also you can see the onion skin appearance. Yes, sir. So, shall we come later? Right, question number 8. It's a good question. Okay, so yes, this is actually the patient will go for an endoscopy procedure for using the pseudomonas. I told no, there's a one question pseudomonas. As you say, infected endoscope that contacts the mucosal vein but does not penetrate the sterile tissue according to the spotting classification to everything. Okay, leave all those diagram. Okay, one important key point is you wanted to sterile the endoscopy. That is what we are asking. Okay, you need not to waste time by reading word by word each by each. Okay, line by line. Okay, if you do that, you will lose the time. Okay. this year, the time management was very, very difficult for so many students. Many of the students not able to went back and revise the questions. Okay, even some students actually missed over 5 questions, 10 questions without reading them. Okay, so time management is the most critical factor for the success of your exam. Okay, so that is why I'm telling again repeatedly, right? Mock test, mock test, mock test. Okay, right? Okay, maximum mock test you have to attend it. Okay, you have to practice. You have to just by seeing the paragraph, your eyes to should go towards the key points. Should not read entire. Okay, so the one key point is endoscopy. How do you sterile the endoscope? How do you sterile the bronchoscope? Okay, any tube-like systems are usually sterilized by glutaraldehyde, endoscope, bronchoscope, everything is sterilized by glutaraldehyde. What is especially the concentration of glutaraldehyde is 2%. 2% glutaraldehyde. What is this 2% glutaraldehyde otherwise called as? The 2% glutaraldehyde usually otherwise called as Sidex. What is the extra point which you should know here? Okay, they're talking about the Spalding classification. What is called as Spalding classification? The Spalding classification is, okay, there are three types of instrument. Okay, he says three type of instrument: critical type of instrument, the semi-critical instrument, non-critical instruments. Are there three types of instrument he is studying? Okay, so what is called as critical instruments? Critical instruments are the instrument if you touch the blood, then it is called as the critical instrument. Okay, for example, your extraction forceps. I can say it is a critical instrument. What is the semi-critical instrument? Semi-critical instrument which is just touching the mucous membrane, salivary contact, then it is called a semi-critical instrument. I can say mouth mirror is an example for the semi-critical instrument. What is called non-critical instrument? Okay, the instrument which is surrounding the patient, which is called as the non-critical instrument. I can say dental chair. Dental chair is an example for the non-critical instrument. Okay. So these are the three types of instrument according to the Spalding classification. Whenever it is touching the blood field, surgical field, critical instrument, the critical instrument should go for sterilization. Sterilization. After which among the following is sterilization? Autoclave. Autoclave is the best method of sterilization. You ask me about critical instrument. But what about endoscope? Endoscope does not work in the field. Actually, endoscope is just to okay, mucous membrane, touch the mucous membrane, does not touch the blood. This is called semi-critical instrument. Usually for a semi-critical instrument, we go for high-level disinfection. Students, disinfection is different, sterilization is different. Last endo plus I told us. Okay. So for a critical instrument, you should go for autoclave, sterilization. For a semi-critical instrument, you can go for high-level disinfection. High-level disinfection. For a non-critical instruments, you can go for medium-level infection or okay, low-level disinfection. This is what the Spalding classification for the instruments, right? Shall I move on to the next one? Yes. Yeah, this is actually the same type of question, but see this question. Actually, there is a patient who has a mild neurological complaint. The word neurological complaint, such as like a tingling sensation, but there is a no word called microcytic hypochromic. It tingling sensation, neurological complaint. Which anemia do you think has a neurological manifestation? Neurological manifestation usually seen with the vitamin B12 deficiency. B12 deficiency related to which type of anemia? B12 deficiency related to the Fernicis anemia. Students, clearance is so easy question. Straightforward. Fernicis anemia. This type of question you can easily score. Okay. So yes, students. So again, very easy question. Just now we studied this type of question again. Okay, yes, the patient has a hemochromatosis. Hemochromatosis, golden brown granular deposition of iron within the hepatocyte. Students, iron. That is the key point. Which stain is used for staining the iron? Just now we studied. Prussian blue. Just now we studied. Prussian blue. Prussian blue. Combo red is for amyloidosis. IU red O is for fat. Periodic acid skip is for the fat fungus. Okay, is it? She was good. Yes, this is actually one more good question. Okay, easy question. Easy question. What is the key point one I can say? I can go for this key point. Zan cells. Zan cells. Zan cells are seen in where? Zan cells are seen in herpes. Zan cells are seen in herpes. Okay. So answer is one. But herpes is a virus, obviously. Okay, viral infection. Yes. So obviously it is present in where? Fingertips. Okay, fingertips. The herpes is actually supposed to be treating some herpes patient and accidental pinprick injury happened to the finger that is called as herpetic whitlow. Herpetic whitlow. So answer is C. Yes, students. Okay, good question again. Which are the following diagnostic method is used for primary stage of syphilis? Most reliable test for the primary stage of syphilis. I mean, actually, the question is little more lengthier before, little more lengthier. You can say before the development of antibodies. Before the development of antibody, you want to diagnose the initial stage of syphilis, not primary. Initial stage of syphilis. This is the exact question. Just how it was actually. Before the development of antibodies, what type of test it can go for? Yes. So answer is dark field microscope. Okay, Parmesh Sasima put it. Dark field microscope. Usually for a syphilis, syphilis is caused by Treponema pallidum. Treponema pallidum actually belongs to spirochetes. For a spirochetes, usually we go for the dark field microscopes. Or the other test actually used only for the later stage of the syphilis. Especially VDR. What is the purpose of VDR? Venereal Disease Research Laboratory. This is a previous year paper. When suppose the patient is diagnosed as syphilis and you started the treatment, okay, after started the treatment, you have to check the patient and the patient is really improving or not. So for this, you are using the test called as VDRL. VDRL is after you given the treatment, whether the treatment what really reached to the patient or there is improvement in the treatment. So that is where we can use this VDRL. Students clear as there are so many things to read about subjects, but since we don't have we have little time, students going to the other questions. Right, students, so easy question. RBC is less. Okay, WBC is less. WBC is less. Platelet is less. Thrombocytopenia. RBC is less. WBC is less. Platelet is less. Everything is less. All this is called. This is called aplastic anemia. Can you do antibiotics? Okay, or two drugs which causes aplastic anemia, very commonly. Two drugs which causes aplastic anemia very commonly. Anybody? Come on. Yes. Okay, just two drugs. Carbamazepine, very good. Carbamazepine, which causes aplastic anemia. What is one more drug? Chloramphenicol. Chloramphenicol. Which also causes aplastic anemia. These are all the microbiology questions. Any doubt in the microbiology? Okay. Yes, sir. Karmis, thank you. Shreya, Sri Vashmi, thank you. So give me 2 minutes time. Okay. So just go for the next two subjects, oral pathology and anatomy questions. Just give me 2 minutes time. Like, yes. Submit this question we already discussed actually, that's why I repeated it. Actually, I skipped actually. Okay. Broad spectrum antibiotic diarrhea which is related to the clostridium difficile. We already studied this in general pathology. Okay, this is also like I am telling that the patient go for the hemolysis. Since the patient goes for the hemolysis, I'm going for the answer called G6P deficiency because G6PD, glucose 6 phosphate dehydrogenase, which prevent the oxidation of RBC. If the enzyme is defective, the RBC will break, will go for the hemolysis. That is why the answer is B. Samita, got it clear? Shall we move on to the next subject? Right. So next subject is anatomy and followed by we have oral pathology. Okay. So these are the subjects we are going to discuss today. So coming to the anatomy questions, let's go for the first question, students. So easy question. Okay. Yes. So this question is about identify the marked region. Okay. So actually the arrow is given here, somewhat actually. So they given the picture of the spinal cord. Okay. And so thread-like structure is given. Okay, what is this thread-like structures are called as? That is a question. The thread-like structure, which is at the seen in the end of the spinal cord, is called as what? Anyone? Whether it is called as phylum terminale or cauda equina. Phylum terminale is actually the end part of the spinal cord is called as the phylum terminale. Okay, this part. The tail-like structure is called as cauda equina. Cauda equina is nothing but in other language, Latin it is called as tail of the horse. It Paraipunis, Yamini, very good. Okay. Tail of the horse. So is Shreya corrected? So answer is what? Phylum terminal. So coming to the next question, identify the canal is. So what is this called? This picture. This picture is okay. Yes, sir. So what is this canal is called as? Either it is called as Oakman canal or Haversian canal. That is a question actually. Yes, many of you say it is a Haversian canal. It's good. Very good. It is called as the Haversian canal. Whether it is Haversian canal or Oakman canal. Yes, yes, yes. Students. Okay, actually the picture they are asking about this. This one they are asked. Okay. But I think the most of you are telling about this picture. Okay. This picture you are telling. Okay. So this is called Oakman canal. What this is called as Oakman canal. So answer is A. Here, what is called Oakman canal? What is called Haversian canal? Oakman canals are something like a horizontal canal. Horizontal canal perpendicular to the long axis of the bone. Okay, perpendicular to the long axis of the bone. Something like this. This is called as Oakman canal. So what is called Haversian canal? Haversian canal usually go parallel to the long axis of the bone. Parallel to the long axis. So, something like in a home or in a building, the lift is present, right? The lift is called as the Haversian canal, which is parallel. Okay. Lift is called as the parallel. Somewhat like this floor. The floor is called as Oakman canal. Floor is called as Oakman canal, which is perpendicular to the long axis of the bone. Students, clear is it? Right. Shall we move on to the next question? So question number 3. Okay, this is a very, very good question actually. Which of the landmark is identification of the facial nerve after it exits from the stylomastoid pyramid? Students, I'm telling you this. In anatomy, okay, you need not to study all the cranial nerves in depth. There are two cranial nerves. You have to read A to Z, every single point you should read. Okay, what are the two nerves? Fifth nerve and seventh nerve. Each ever in the single word is very important. Okay, so for any MDS exam, if they ask some question from the cranial nerve, they will be taken this only to these two cranial nerves. Fifth cranial and the seventh cranial. Okay, other cranial nerves only the important points of that is enough. Okay, usually the seventh cranial, that is a facial cranial nerve. So this exam, NEET MDS, almost 3 questions to 4 questions actually came from the facial nerve itself. 3 to 4 questions came from the facial nerve. Facial nerve from the inside the cranium, when it wanted to come out of the extracranial pores, it is exit from the foramen, which is called as the stylomastoid foramen. Probably you know this, right? So you have the sharp projection called the styloid process, and you have a blend process which is called mastoid process. In between, you have the foramen which is called as stylomastoid foramen. So through the stylomastoid foramen, it is usually exit. After it exits from the stylomastoid foramen, it enters into the face and gives 5 branches, all those things. The question is about when it exits from the stylomastoid foramen, where you should palpate, where should identify, what is the landmark which is used? The landmark which is used, which is called as the tragus point. Okay, tragus point. And what is the muscle which is attached here? Usually, the muscle which is attached here, mastoid process, the muscle which is attached here is called as posterior bilium digastric. Okay, all those we studied in anatomy classes. Who attended anatomy class, my anatomy classes, okay, probably remember this. Okay, there is a two digastric muscle, anterior digastric muscle and posterior digastric muscle. Anterior bilium digastric, which has the starting point from this area, which is called as digastric fossa. Posterior bilium digastric, which is attached from the mastoid notch, mastoid process. So where, okay, so what where the patient now when it exits from the stylomastoid foramen, okay, when you palpate, obviously we palpate here on the right posterior digastric only will be palpate, and also we can eliminate this anterior digastric. Okay, so carotid is not a point at all. Close to the stylomastoid foramen, you have this. Cannot eliminate mastoid process. Okay. So posterior digastric, it would say just to posterior to the foramen. Answer is what? A. Coming to this A, students, last 4 years, there is a question comes from arch and pouch. Okay, if you go to NEET MDS exam center, okay, the security will be there. The security asks you, okay, did you completed your pharyngeal arch and pouches? Okay, that much familiar. The NEET MDS exam, this is so familiar. Because for the last 4 years, continuously they are asking some question. If we say I'm not a completed arch and the pouch, the security says go prepare and come for next year. Okay. இந்த அளவுக்கு ரொம்ப ஸ்ட்ராங்கான டாபிக் ஆக்சுவலா படிக்காம எக்ஸாம் டியூ போயிடாது. Okay, right. So the patient present with absent thymus and inferior parathyroid. Okay, which are the following embryological structures causing this defect? Anatomy class like taken this. This is Asima, very good name. It's called a third pharyngeal pouch. Thymus and inferior parathyroid develops from the third pharyngeal pouch. Superior parathyroid develops from the fourth pharyngeal pouch. So easy questions. Straightforward question. If we know the arch and the pouch derivative, we'll get 4 marks easy. Okay. Third one. What is the syndrome is called? This syndrome is called Dye-George syndrome. So what is the syndrome is called as Dye-George syndrome. Okay. Right. So come back to this. This is okay. Again, there are 3 questions actually from pharyngeal arch and the pouch derivative this time. If you are strong in pharyngeal arch and pouch, you got 12 marks. What is the question? Hearing loss where incus of ear is absent. About which arch it is? In ear cartilage, there are three ear cartilages: malleus, incusstates, MIS, malleus incusstates. Malleus and incus develops from which arch? First pharyngeal arch. States develops from the second pharyngeal arch. Okay, since they're telling about the incus, we can easily tell it is a first pharyngeal arch. Yes, sir. Right. So congenitally deaf child which has a defect in charge. Okay, congenitally deaf child usually has the problem of which cartilage again states. Okay, usually which cartilage is most common defect, which cartilage is mostly defective in states. Suppose states actually are okay related to which cartilage? Which arch is second? States related to second arch. Right. So next question. If tympanic plexus level injury occurred, what will happen? Tympanic plexus usually related to the course of which tympanic plexus related to the course of glossopharyngeal nerve. Glossopharyngeal nerve, which actually passes around the uh, tympanic plexus, it supplies for the parotid gland. It supplies for the parotid gland. So if there is any problem happened related to the tympanic plexus, the patient will lose the parotid secretion loss. So answer is B. Okay, so student, don't worry, all these questions. Easy question. Actually, it is an image-based question. Sorry, video-based question. There are four video-based questions. First time in NEET MDS exam, they are started to ask video-based question. Actually, okay, a small video like for 5 seconds, 10 seconds, like that. Okay, yes. So this video actually shows about when the patient is open the mouth, the angle is deviated. Okay, so like that they given the image. So if the angle of the mouth is deviated, it is actually related to the damage to which nerve? Which nerve? Obviously, patient. Patient nerve is related. Okay, facial nerve palsy. Usually, the angle of the mouth will be deviated, right? So this is the answer. So it's a straightforward question only. Okay. But what about buccal? There are the two buccal. One is like the buccal branch of the facial nerve. There is one more buccal nerve which is related to the trigeminal. The buccal branch of the trigeminal nerve is sensory. The buccal branch of facial nerve is motor. Well, yes, well. Okay. So that is sensory disturbance. Okay. Motor. So that is why if there is a deviation happened, I can go for buccal branch of facial. Right. So this is again a good question, but okay. Ask the previous NEET exam. What is the one key point I can go? I can leave all those extra points. I'm just telling this. I will go for this only one. Loss of sensation over the angle of the mandible. What is the sensory supply for the angle of the mandible? The sensory nerve supply for the angle of the mandible, this area, which is by the great auricular. This is also studied in anatomy class. Okay, if you not remember, please go back and read one more time, students. Okay, great auricular. Shamita Gundar, great auricular nerve which supplies for the angle of the mandible. What is great auricular nerve? Great auricular nerve is formed by great auricular nerve is formed by second cervical nerve and third cervical nerve. C2 and C3. Okay, together forms the great auricular nerve. So next question. Yes. There is a surgery which is related to the piriform fossa, and the patient classes the sensory nerve, sensory supply. Which nerve is affected? Which nerve is affected? Okay. So usually the piriform fossa is present above the vocal fold. Above the vocal fold. So this is the okay. Just remember, this is the vocal fold. Above the vocal fold is the piriform fossa is present. But you have to know the sensory nerve supply above the vocal fold, below the vocal fold. If we know that, we can able to answer. Above the vocal fold, the sensory nerve supply is internal laryngeal. Internal laryngeal. Okay, so answer is A. What is below the vocal fold? Below the vocal fold, what is the sensory nerve supply? Below the vocal fold is recurrent laryngeal nerve. The sensory nerve supply for the larynx. Sensory nerve supply for the larynx. Meanwhile, what is the motor nerve supply for the larynx? Motor means muscle. When I am talking about motor means muscle. Okay. All the muscles of larynx supplied by all the muscles of larynx supplied by recurrent laryngeal nerve, except only one muscle. What is that only one muscle which is exception? Cricothyroid. Cricothyroid is supplied by external laryngeal nerve. Cricothyroid is supplied by external laryngeal nerve. So, Sima put Yamini put Cricothyroid is supplied by external laryngeal nerve. Okay, yes. Cricothyroid, why it is external laryngeal nerve? Because it is the only muscle which is present in the external surface of the larynx. So that is what is supplied by the external laryngeal. Okay. So student, this is the sensory nerve supply for the larynx. This is the motor nerve supply for the larynx. Okay, this is again a good question. The patient is not able to perform the skilled movement. Okay, so there is some extra word here with the good strength. Strength and tone is good. Good with the good strength and tone, which is there was an exam. Sensory function is normal. Which area is involved? Okay, to perform the skilled movement, which area is needed? Premotor area is needed for the skilled movement. Okay. Next question. So a very evergreen topic. Okay, this question is coming for last 15 years. Even during my preparation also, this question was there. For you also, this question is there. Okay, so evergreen question. The road traffic accident diagnosed with an extradural hemorrhage in the region of period. Which artery is most commonly involved? Okay, period is related to which artery? The period is okay. Just inner side of the period, we have an artery called as middle meningeal artery. The middle meningeal artery. Okay, there is a damage to the area. Middle meningeal artery will rupture. That rupture which causes what? That rupture which causes extradural hemorrhage. Which is the artery involved with extradural hemorrhage means middle meningeal artery. There are so many types of hemorrhage in the brain. Extradural, subdural, subarachnoid. Okay, especially which division of middle meningeal artery. Nowadays, they are started to ask you that question. Anterior division of middle meningeal artery. Okay, which hemorrhage associated with the lucid interval? Okay. Extradural, subdural, subarachnoid hemorrhage. Which hemorrhage is associated with the lucid interval? What is called lucid interval? Lucid interval means after the trauma, the patient got unconscious. It, and so suddenly the patient will wake up. Okay, wake up and he go to the home and do the normal cooking activities, everything. Okay. And after some time again the patient got unconscious. Then they bring it to the hospital. Okay. So immediately he got unconscious. He woke up and do some work. Again he got unconscious. The time period between the two unconscious is called as lucid interval. The time period between the two is called as lucid interval. The lucid interval is the characteristic feature of extradural hemorrhage. Students clear? Yes. So I move on to the next question. The palatine tonsil drains into straight forward question. Palatine tonsil drains into jugulodigastric. Palatine tonsil drains into jugulodigastric. After hemimandibulectomy, a patient has a mandibular deviation. Which muscle is affected? So, which muscle causes? Actually, the question is like this. Which muscle causes deviation of mandible? Exactly the question was there. Causes deviation of mandible. Yes. So what is the answer? Lateral pterygoid. Sasima Godel. So very important question. Actually, this question is asked many times. Okay. If you see this, just imagine this is a door. Just imagine this is a door. Okay. And door. So this is closed now. Okay. If you wanted to open it, okay. So somebody is opening this side. So somebody is pulling this side, and somebody is pulling this side, okay, whether the door will open or not. Door is open or not. Okay, door is there. Somebody is pushing from this side and somebody is pushing from this. Whether the door is open or not, doesn't open. Similarly, lateral pterygoid, which pushes the mandible to this lateral pterygoid, which is to push the mandible to my left side. This lateral pterygoid, which pulls my mandible to the right side. Both lateral pterygoid will try to push the mandible to the opposite side. Okay, but because both are doing opposite function, it's nullified. My mandible is in neutral position. But suppose if I cutting my right side mandible is removed, okay. So my mandible is removed. There is no lateral pterygoid. So there is no lateral pterygoid. What will happen? So this lateral pterygoid obviously passing mandible pushes to the opposite side. This is the question actually. Okay. After mandibulectomy, there is a deviation of the mandible. The deviation of the mandible, which is caused by what? Lateral pterygoid. Yes, sir. So answer is A. So these are the questions which are asked, almost 13 questions, right? This is with the 14 questions. Any questions from, any doubts from the anatomy students? Any doubts from the anatomy class? Okay, that means thank you, Sasima. How many thank you? Right. Christy, thank you. Right. Shall I move on to the next subject, students? Yes, sir. So oral pathology. Okay, right. So last subject for today is very easy question, students. Very easy question. Okay. So what is the key point if I say like immediately I can go for the answer? There's only one key point is enough. One key point is enough. Chocolate colored fluid. So usually I will be telling this in my oral pathology class. Okay, chocolate colored fluid. It's a seen in which tumor? Watkins tumor. Watkins tumor, otherwise called as what? Watkins tumor, otherwise called as papillary cystadenoma lymphomatosum. Papillary cystadenoma lymphomatosum. See this question. What are the other key points? I can go for papillary structure. So papillary. Okay. Obviously, you have cystal, okay, and dense lymphoid stroma. Lymphomatosum. Papillary cystadenoma lymphomatosum. Okay. So that is why I can go for the Watkins tumor. What is the question which is commonly asked in your pleomorphic adenoma? The most common benign tumor of the salivary gland is what? Answer is pleomorphic adenoma. Most common benign salivary gland tumor, pleomorphic adenoma. Okay. So, yes. And what about the canalicular adenoma? Canalicular adenoma, usually we have some very important point histopathologically. So we have something called as party wall appearance. Party wall appearance which is seen in the canalicular adenoma. What about mucoepidermoid carcinoma? Most common malignant salivary gland tumor. Most common malignant salivary gland tumor is mucoepidermoid carcinoma. Students, is clear? So anyone will discuss? Okay, so this is also very easy question. The only one key point I can easily answer. What is this key point? Swiss cheese pattern. Swiss cheese pattern. Puriform pattern. The puriform pattern of Swiss cheese pattern is seen in now. It is seen in the adenoid cystic carcinoma. Okay, so I can easily answer these questions. Okay, this is actually an image-based question, student. I'm skipping this. I'm not able to get the image actually. With that image only I can able to make you to understand this question. Right, so this question is so easy. An HIV positive patient present with the erythematous patches and the dorsal aspect of the erythematous patches. Buccal mucosa with palate and associated with burning sensation. What is the most likely diagnosis? Very, very easy question. Easy question. Obviously, for a patient of HIV, the immunity is coming down. Whenever the patient is immunocompromised, what will be the infection commonly? Immunocompromised patient, candidiasis is more common. And they say about the red erythematous patches, images also given. If I can easily go for what? Erythematous candidiasis, so easy, right? Anybody can answer. So next question. Yeah, this is also so easy question. So easy question. There is a vesicle in the lower lip and the conjunctiva. So since they're talking about something related to the eye, which is related to the eyes? Psychotrical. Psychotrical means eye. Okay, so psychotrical can be read. And one more key point I can give. Subepithelial spread that is also seen in the psychotrical can be read. Subepithelial means, okay, just below the basement membrane. Okay, this is called as subepithelial. Right. So psychotrical can be read. I can go. Right. Next question. Yes. So what is this called? Students who found some easy question. Okay, there is a swelling on the one side of the maxilla. Plurilocular radiolosis with the deciduous canine inflames and lesions surrounding the CEJ of the impacted canine. CEJ of the impacted maxillary canine. Whenever you are talking about some impaction, the cyst, something related to the impaction, what is the cyst? Since it's a cyst, obviously, so easy. When is it a cyst? Okay, since I am related to the impaction, I can easily answer it is a dentigerous cyst. What is dentigerous cyst otherwise called as? Follicular cyst. Dentigerous cyst otherwise called as follicular cyst. Listen. So actually this question, many students made a mistake. Many students made a mistake, right? Okay, careless mistake. Sure, this is little trap mistake. Cannot take trap actually. You think time if you think you can avoid that mistake. So the question is about what the patient actually presents to the central area of the deep population of the dorsal surface of the lung, the same type of lesion which is seen in the palate. So what is this lesion is called? Sasima says D, Shamukta says E, Sri Vashini says kissing lesion is very good. Actually, students, Bhakyam. Okay. Actually, the patient has some problem in the central area of the tongue. Okay. The same type of lesion is seen in the palate also. Okay, what does it means? The patient has some candidiasis in the tongue. The same candidiasis spread to the palate. Okay, that is the meaning. So, okay. So if the candidiasis spread to the palate, it is usually called it as kissing lesion. Kissing lesion. So what is given here? Is given as a kissing disease. Okay, many students actually suddenly they went for kissing disease, and that's why I'm telling you it's a very, very careless mistake. It's not kissing disease. What is kissing disease? There is a difference between the kissing disease and the kissing lesion. Kissing disease is infectious mononucleosis. Infectious mononucleosis, otherwise called as kissing disease. Infectious mononucleosis is caused by the Epstein-Barr virus. Okay, and what is this? This is called median rhomboid glossitis. Okay, the median rhomboid glossitis usually infected with the candidiasis. Okay, so students clear. Dharmesh Sreya, correct? Right, next question. There is a yes, unerupted maxillary incisor shown in the picture. Multiple tooth-like structure, that is the key point. Multiple tooth-like structure. The multiple tooth-like structure it is called as odontoma. But compound odontoma or complex odontoma? If it is a tooth-like structure, it is called a compound. Tooth-like structure it is called a compound. Irregular structure, clumsy, it is called as complex odontoma. The one more difference is what is more common in anterior maxilla? Compound odontoma. What is common in posterior mandible? Complex odontoma. Is so Shreya Yamini Buddha. So next question. Again, so easy question. Oral pathology, you can get 100 out of 100. Okay. So even for the students who prepare for 2020, this is usually I say oral pathology, if you score 100 out of 100, okay, your rank is very good, decent rank you can go. Okay. Because there are a lot of questions in oral pathology, oral medicine, and radiology. Almost even this year also we got 20, more than 25 questions actually. Okay. Oral pathology and oral medicine together. Now I am discussing oral pathology only. Tomorrow part I am going, tomorrow or day after tomorrow I am discussing about oral medicine. Right. So yellow is visceral teeth. Teeth is affected. Okay. Enamel hypoglycemia. Hair is affected. Nail is affected. Frontal bossy. Bone is affected. And what is this called? Tricho. Tricho means what? Hair. Kinky hair. Tricho means hair. Teeth is affected. Dento. Bone is affected. Frontal bossy. RCS. What is this called? Trichodento-osseous syndrome. Right? Trichodento-osseous syndrome. Usually, where you came across this trichodento-osseous syndrome? In which case you will come across this trichodento-osseous syndrome? Anyone? Thyroidism. Thyroidism usually associated with trichodento-osseous syndrome. Thyroidism usually have two syndromes associated. One is the Klinefelter syndrome. The other is the trichodento-osseous syndrome. Right. So, yeah, this is actually the patient has a lesion in the lower limb caused by the extravasation of the leucine adjacent to the soft tissue. Okay, so there is an image actually. Okay, so the limb layer there is a lesion which is actually shows leukocyte. Okay, so what is the answer? Ranula I can eliminate because it is seen in the lip biting, chronic lip biting. Ranula is actually present in the floor of the lung. So we're talking about lip biting, I can eliminate the ranula, meningioma, because it's so easy question actually. So mucus, especially mucus extravasation cyst. What is the meaning of mucus extravasation cyst? Imagine you have the salivary gland, minor salivary gland. You have the duct of the minor salivary gland. Okay. Suppose the patient got lip biting. So because of the lip biting, so the duct got damaged. The duct has got damaged. Since the duct has got damaged, all the saliva which is coming out like this. Okay, and stay there in the tissue space that causes the swelling, which is called mucus extravasation. There is a one more type of cyst which is called mucus retention cyst. That is because of any thyroid stone. There is any stone, the mucus will start accumulate that it causes mucus retention cyst. So usually for a patient of lip biting, the patient will get a mucus extravasation cyst because of the duct got damage. Yes, sir. So 11th question. Which are the following shows thyroidism? Actually, there is a given picture is given here about the thyroidism picture. There is a picture of sorry. There is a picture of thyroidism given here. This picture is given. Okay, just a thyroidism picture is given. Obviously, I told just now. I told Klinefelter syndrome associated with the thyroidism. What is thyroidism? Otherwise, called this bull teeth. Bull teeth. Sturge-Weber syndrome associated with hemangioma. Okay, these are the oral pathology questions. Almost 11 questions. Okay, and there are almost 11 to 12 questions from the oral medicine also. Okay, we'll be discussing that question. The next session, right? Okay. Any doubt in today's discussion, students? If you have any doubt, you can give it in the chat box. Just to clear your doubts. Shyam, thank you. Sri, thank you. Yamini, good. Shreya, good. Manish, wow, very good. So thank you, students. Just to design the date and time and tell you the next session. Probably tomorrow morning I will confirm the date. Okay. So till that, students who are preparing for 2027, so prepare your pathology part. So this Sunday, so you will be having the test actually 50 marks tested, 50 question test. What is the portion? The portions are from my general pathology, part 1 and part 2. Try to complete the first question also. And along with NEET MDS 2026 question, whatever we discussed, okay, we will be having the test for this Sunday school. So for the Sunday, we have the class also. Okay, class I am going to talk about two important chapters. The inflammation, acute inflammation we completed. We're going to start with the chronic inflammation and one more important chapter which I'm going to complete this Sunday, genetics. Okay, so genetics, if you, there are so many things we are going to study in genetics. Actually, one of the very important. Usually, students feel difficult to study this part. I make it as most simplified version. Okay, so I don't want any students to miss this Sunday class. So try to attend the session without fail. Okay. So all the best. We'll see you in the next session. Thank you, students, for stayed till the end of the class. Okay. Great.